and putting the heart and head of that employee into that process, right? The process should be reliable, which means it gets the outcome, and it should be repeatable. Means every time you do it, you get the same outcome consistently. Process actually reduces our dependence on people. Yeah? So if you look at it, all in our organization, think about it, you will have some key people who you're over-dependent on. And you're nervous about these people. Will they leave? What happens if there is attrition? And the root cause of that is your process. I'm not saying competence at an individual level is not important, but we make it worse by not having process. Process actually de-risks the company. Now, you can reflect on how many of us, we have a few key people that we are really nervous about them leaving, right? So, and there we are defective. We need to improve, right? So I want to summarize that purpose and process builds excellence, right, in your organization. And excellence gives you great stakeholder experience, and that great stakeholder experience gives you your surpluses and your profits. Now, India has a great promise as a country, but unfortunately, whenever we talk about India, we talk about our past, not about our present. We say, oh, we invented the zero. We built the Taj Mahal. We did this. It was all the past. The today's generation doesn't have anything to talk about today's achievement that we can all be proud of and which is world-class. We have an opportunity to create something today that the future generations will look back and say, wow, India is a great country, right? So I wish you and everyone here my best, and I look forward to seeing some phenomenal stuff coming out of your entire faculty. Thank you very much.
Thank you, Dr. Jairam, for your words. Next up, I would like to invite Dr. Professor S. Rajashekharan, ladies and gentlemen, Chairman, Department of Orthopedics, Ganga Medical Center and Hospitals. Ladies and gentlemen, Dr. Rajashekharan on the dais. So please.
Good morning to all of you. Thank you so much for having me here. I think I should first start off with congratulating people who made AHPI possible. And I very clearly remember nearly 2 decades before, while we were all involved in the running up and setting up of AHPICON, it was Dr. Devi Shetty, Dr. Alexander Thomas, and a few of us who decided that we should bring all the stakeholders who are delivering healthcare together, because there was no podium, there was no platform, and there was no common voice for people who are delivering healthcare in India. And as usual, there is always this enthusiasm of Dr. Devi Shetty, forethought, inspiration, I'll say, and Alex is always his engine. And this is a very powerful combination which has made so many things possible in our country. And truly, the person whom they thought who could make it possible was our Dr. Gyani sir. And this trio made AHPI possible. And now we have a true voice even with the Ministry of Healthcare in Delhi. So on behalf of all of you, I should first congratulate them and give them a big hand to these people who made this possible. Now AHPI has done many things and has been a voice for many of the needs for the healthcare, and they also brought a lot of people together. Like we always say, in the medical treatment, if you look at from end to beginning to end, it is not just the hospitals, it's not the doctors, but it's a whole range of healthcare professionals involved, both within the hospital and also outside the hospital. And as the Chinese proverb goes, if you want to run fast, you can run alone. But if you really want to run far, you have to run together. And we really hoped at that time that AHPI will be the organization that will make everybody hold their hands together and run together. And we are achieving a lot towards this. I'm really glad that I'm speaking after Dr. Jairam Varadaraj, because he spoke about purpose and process. Now, I think it is like the left side and the right side of the heart, and they have to be together to achieve this. I also heard from him before itself how he has managed to bring equity into their organizations, and this was a very revolutionary thought. Because this morning I read in the newspaper that Mr. Elon Musk has been sanctioned $1 trillion. And now we have Dr. Jairam Varadaraj talking about only a pay parity of less than 32 times. Two completely opposite thought processes, but we know where wisdom lies. We know where the compassion lies, and I really think that this is something that we should all think about. Because if healthcare in India should improve, it is not going to improve with just building big hospitals or getting big doctors, but all the other professionals, in fact the nurses, should also be very good. And one single factor which does not allow very good people to enter into these professions is the sheer disparity in pay. Now, if you look at in the United States or in the UK, the pay parity is not so much. In fact, there are a lot of brilliant people. For example, the professor of orthopedics in Flinders University, Australia, is a very close friend of mine. And his daughter got a medical seat, but then chose to enter into nursing profession. And she said, I have admission in both nursing college and medical college. And she said, after a lot of thought process, I decided to become a nurse. People from Philippines, they prefer to be a nurse in the US than to be a doctor in Philippines, because there is no big difference in pay, and there is a big difference in pay of being a doctor in Philippines or being a nurse in the United States. So in fact, 60% of medical colleges in Philippines run a combo course, they call combo course, where they are enrolled. In their third year, they do a examination and become qualified for a nurse, and they continue for one more year and become a doctor. They all go to US and then become a nurse. So these things ensure that the nursing standards in those countries are really very, very high. And one of the things that we don't attract people of high quality into paramedical staff is because of the huge pay parity. And this is something that all of us must look into very much. I would also request that AHPI has looked into many important things for the health sectors. We have lots of problems. We have problems with the processes, we have problems with government sanctions, approvals, insurance, you name it. It is a big problem to run an organization in India. And AHI has been a very successful, vociferous voice for us and solving a lot of problems. But I would also encourage the leadership of AHPI that they should not be just a voice for the hospitals and for the healthcare professionals, but in fact to go a little further and to become the voice of the patient himself. And that actually will transform the association, and will also set their aims much farther higher so that they become a more effective organization. In the times when AHPA was started, the scenario of practice was very different. The doctor was a demigod, which also set their aims much farther higher so that they become a more effective organization. when the times when AHPA was started, the scenario of practice was very different. The doctor was a demigod, and we almost had 80% of the people coming and tell us, Doctor, you please do whatever you think best, but no longer. I mean, 80% of our patient now comes and says, I have searched the Google, or they say ChatGPT tells a little different from what you're telling. And so the consultation across the table is, and now it is almost sometimes a collaborative talk of two informed individuals, or sometimes it even turns out to be a debate if the ChatGPT has told something different from what you are. So for this informed patient, our orientation of delivering healthcare must be completely different. And I would suggest that AHPA must actually look into how it improves the treatment experience of the patient, how it improves the quality of the care that is being delivered to the patient, and how treatment actually becomes more safe. So we can bring all the technology, we can bring all the latest techniques, but if in the end we forget that still the most valuable thing inside the hospital is a kind ear which listens to the patient and a compassionate heart which feels empathetic to the patient, then a lot of things would have become different. Because as never before, we are capable of diagnosing early, treating effectively. But if you just see in the last Gallup poll which has been done in Europe, the trust factor of the doctors has come down from 71.5% to 40.2%. Nurses, school teachers, pharmacists, and armed forces, they all have gone up, whereas the trust factor on the doctors and hospitals have gone down. Now, this is something that we have to be really worried about. And I think we should put all our concentration into how to get this trust back. We have to be really truthful to the patient. Not only truthful, but also make the patient safe and secure. They should feel safe and secure to be in the hands of the treating physician or the hospital. And if we lose that, then in whatever we have won, it is not a true win. So I think that we should be actually concentrating on this, and I'm sure that the AHPI will do this, and all of us are united in this cause. So thank you very much for having me here. It's a great pleasure, and I wish this conference all the very best, and I'm sure there will be great deliberations of good use to everybody. Thank you very much.
Thank you, Doctor, for your kind words. We're truly honored in having you here. So, ladies and gentlemen, before I invite the next person to speak, I would like to invite Mrs. Rama Rajashekaran, Organizing Chairman, to speak about what AHPICON 2025 is all about. So let's all give her a round of applause as I invite Mrs. Rama Rajashekaran onto the stage.
Wonderful. In fact, I'd like to welcome each and everyone over here, especially really warm words welcome to Jairam Varadaraj for having come and graced this. And of course, the whole AHPA committed flag, I can say they are the torch bearers for us. And all the delegates who have come here and all the stalls and all the different participants, it's really a wonderful moment. And before, I really wanted to tell you why we had selected this theme, because it's very important. When we were contemplating as why to do it, it was like, we just, if you all want to just know it, it was like from sustainability to scalability, empowering every hospital tier. I thought, as everybody knows, AHPI has got a combination of different hospitals and clinics and nursing homes. Because today I feel the healthcare has taken a very different turn, and the concept of just sustaining excellence is no longer enough, because definitely sustainability gives us a lot of strength, it gives a lot of resilience and a purpose to definitely, as all of them say, to take care of the sick. But now with so many new interventions, and as you know, most of the all the stalls here, all of them have a special on AI related or technology related. So we all have to move up. But now I think the true really challenge for us lies in being scalable. We all have to scale up. So everybody wants definitely to scale up. And as Jairam said, it is very important having a purpose and a process. And it's all that is important, definitely, to scale up. Since all new concepts which keep coming in healthcare, it must be, as AHPI, we really wanted to reach out to every hospital of every tier. That was our main focus, because it's just not the progress is not very not very valuable. It has to be available to everybody. It can't be just available to a few. So in fact, when at the and also it was not only to our target was all 2-tier, 3-tier cities, so that there is scalability is there. Everybody should feel it. It is just not you can just okay. I'm just sustaining. Is all those words have gone now, and also so long we used to definitely, as they say, we have the power to heal with dignity, of course, efficiency, and of course, hope makes any power very empowered. So all hospitals, everything must be empowered. And I think only when you scale up can you attain that. And with this in our mind, AHPI really proposed to create a very scalable model, so that we're having wonderful sessions. In fact, every session we have really good speakers and panelists. I'm sure everybody will benefit and have a lot of take-home message. It's just that not only we have on quality, but insurance, which is a very important for everybody. Insurance is scalable, and as they all said, the workforce, the HR plays a very important role. It is just not, and of course technology, and we have finance also. And I really have to, all the delegates must feel very happy, because all the panelists have traveled from far. In fact, they come from Mumbai and Pune and from different places of India. So that really adds to it, and they really want to share everything, their ideas, and it's going to be a wonderful session. And the most important is, I'm sure every delegate, when they leave at the end of the day, I'm sure they will go back with a lot of new ideas and new innovations for them to really scale up in their place. So that's what we are doing. We are focusing today, and I'm sure I really have to thank everybody for having come. And I'm sure it's going to be a wonderful session. I really welcome all of you. Thank you.
Thank you, ma'am. Next up, ladies and gentlemen, I would like to invite Dr. Girdhar Gyani for the special address, Director General for AHPI. Ladies and gentlemen, a round of applause for Dr. Gyani over here.
Thank you very much. Actually, when I am in Coimbatore, I was trying to recall when did I visit first. I remember it was around year 2000. And then when I became Secretary General, that was another 2 visits. One was organized by the corporation, Municipal Corporation of Coimbatore. And that time, I think that must be the year maybe 2005. And I was surprised to see that at that point of time, they were talking of sustainability. 2005, Municipality of Corporation of Coimbatore. And then they took me around, and I met some of my friends from healthcare. In fact, so I said in my speech that this is a happening city. Things are happening here. This is the point. This is I think one of the kind of tier 2 city which competes with any tier 1 cities in terms of healthcare. When we published our first directory of the hospitals by AHPI, the number of beds which we counted, the 50% of Tamil Nadu beds were found to be in Chennai and Coimbatore. So that is the level of Coimbatore. The 5 hospitals, if I remember immediately, PSG, Kovai, KG, Ganga, Kupuswamy, I think You will not find that size of hospital in any part of the country. All 600, 700,000 bedded hospital in this city of Coimbatore. So I think hats off to, Coimbatore. And let me also tell about HPI Tamil Nadu, although my friend said that, Satish said that about our friend Dr. Raja, that he is the founder of HPI Tamil Nadu. I think you forgot, he corrected it. He is also the founder of the Central HPI. So he has got huge contribution in making the HPI what it is about. So anyway, I think we have very limited time. In fact, I will be advising to the organizer that what is happening in currently, whenever you do this kind of conference and when you name the session inaugural, the people think inaugural means lamp lighting, giving memento, ye wo ho jayega. So let us go after that. So nowadays, they start with the plenary session, where the, spy technical, and keep the inaugural session after tea. Anyway, this is in the lighter mode only, but I am very happy to see, that Coimbatore is very, and of course, let me also add here, the HPI Tamil Nadu chapter is consistently ranked at number 1 out of 21 HPI chapters. Consistently. In fact, this is a great effort, by our team at Tamil Nadu. In fact, I am told Dr. Satish to make presentation in our monthly meeting so that our rest of the chapters also know how actually a chapter should function ideally. Okay, so I will spend, I think, 10 minutes, because I was told by our president that we will have around 15 minutes to. So I just in the morning jotted down 15 points precisely, what actually. So I thought, which are the first 5 positives of India? First 5 positives in healthcare, of course. The first point which came to mind was expanding health system. I don't know whether you realize this or not. In 2018, of course, we said Ayushman Bharat covering 40% of population. Then we recently added 6% of 70 plus, so it becomes 46. 14% is from the private insurance. Another 7% is by ECH, CGHS, ESI. So, all things put together, we are very, fast moving to cover entire population of India. In fact, some of these states I know on paper, Telangana and Andhra, had 90% of population covered under their Arogyashri scheme. And they are now saying, our Chief Minister Chandrababu Naidu, that he will cover 100%. At least, on paper things are moving. Practically there are problems. I will not touch upon that. But still, this is an expanding health system. That is a big positive. Second positive comes about strong private participation. I think you perhaps are not aware. When government is spending less than 2% of GDP, the private equity or private healthcare contribution is close to 2.8%. That means 2 and 2.8 means around 5% we are putting into the health system of India. I think so that is a big contribution of the private sector. And I think somehow, looking at this, government has decided to go slow on their part, and they think that private sector will cover it up in terms of the health system. Anyway, so this is, I consider, very high positive. Growing human resource. 100,000 plus doctors are coming every year. 200,000 nurses are coming every year. In fact, if I remember our good friend Dr. Devi Shetty, he used to say, not now, from number of years, that India can supply human resource to the globe. I think we have, in fact, missed that point. We still have that opportunity, that besides meeting our own requirement, we can be supplying the human resources. Only thing we have to channelize, we have to create that kind of structure, but that is a big plus point. Fourth plus point is pharma and vaccine leadership. I think all of us are aware about it. The branded, generic, and now there is a third category, generic branded. I think you know about it. Few companies have emerged now. They collect generic from the industry and they do retest, apply additional quality measures, and then they sell it under the generic branded. So I think that will perhaps increase the confidence, because many people still do not buy generic. But when you are bringing generic branded, affordable at the same time, hopefully. Anyway, this is the fourth and last and very important, the digital and policy innovations. Government by itself, National Digital Health Mission, though I keep telling in meetings to the government that you are going very slow. 2019, 2020, it was relaunched under the name of Prime Minister National Digital Health Mission, but I think very slow progress is happening. But let me tell you, once this it matures, I think India will be on the path to become the Vishwaguru in the healthcare. So I think these are the 5 positive. Let me now talk about the 5 challenges. The first challenge is the low public health expenditure. I think I already mentioned about it. And in our meetings with the government, they only keep talking that we will reach 2.5%. I don't know when. They were supposed to do in 2025, but I tell you that next 3 years, I can foresee we may reach 2.5, but 2.5 is no good at all. So I think private healthcare has to pitch in a big way. Second is the urban, rural, and regional inequality. That our chief guest also touched upon this point. I think this is a challenge. This definitely is a big challenge. We have done a number of studies in AHPI. I think that really Nadu only has that kind of have to be just doctors are able to hopefully balance in time. Human resource skill gap. I think we have not recently, about 2 years back, government of UP examined all the nursing schools of UP. And they found that more than 40% need to be shut down. I think that is the level I think we are in our country. Similarly, even for the doctors, I think after MBBS, we do not find them good enough to be used in procedures, and everybody now has to go for PG or the super PG. That and allied healthcare, I don't want to even mention. That is a very big gap. So this commission, when will come into operation in full way, Allied and Professional Healthcare Commission, I think things will turn around. And if I want to again go back to Dr. Devi's comment, only when this commission comes into practice, we will have qualified, competent people who can be used in India and also abroad. So this is a skill gap. I think we should be worried about it. And last one is the rising burden of NCDs. I think you are all clear about it. And HPI brought a book on this. Alex, I think, will cover on this one, that lifestyle as a medicine. I think that we have to promote. And let me finally give 5 additional points. 5 plus 5, 10. I thought 15 points. These 5 points are what Raja wanted us to do, that involve work for the patient, work for the consumer. So I think the 5 wishes, if you want, what actually we keep listening from our consumers is, one is accessible and affordable health. That actually everybody is talking about. Yesterday, we found there is on the web that Apollo generates 1.7 lakhs from each patient IPD. It is their own statistics. Of course, this is average. And Apollo, of course, operates only on the high-ended healthcare. But you can imagine that that is the kind of expenditure one has to make. 1.7 lakhs per patient, maybe number of days can be average 4 or 5 days, But that is the kind of money you need. if you really have to get into tertiary or quaternary care. I think that has to be addressed. The only answer to me is that people should go for private insurance. Private insurance has another problem, which I will not discuss, but that is the simple answer. And accessible, I already mentioned that they want that healthcare should be available within 50 kilometer, at least if it is a tertiary care. Let us say 100 kilometers. But that should be the case. Respectful and compassionate care. My own worry is, after we created NABH, clinical quality has gone miles and miles. Surprisingly, service quality is coming down. One of the agency did one survey on 10 top hospitals which in terms of clinical quality. The hospital which came on number 1 in clinical quality was number 7 on service quality, rated by the patient. So I think all of us have to worry about this factor, and how do we improve the service quality. Third, continuity and trust in care. Maybe your patient, they have listened from their fathers and grandfathers that they used to have a family doctor who used to be invited in all the marriage function, birthday function, first card used to be given to him. I think they want to live in that era once again. I don't know. It's not possible for various reasons. Few good things have happened. For example, I keep quoting that average life expectancy of 37 years at the time of independence now is 73 years. So obviously this has happened because of the availability of our competent doctors and the health system. But they have this problem, continuity and trust in care. That is missing. In fact, suppose the patient is consulting one specialist, and after 5 days again he has to call back. Normally he gets the answer, the doctor is busy, talk to his PA, come through the, the normal routine. So I think he gets puzzled about it, that I was with the one doctor for 3 times, and now a 4th time I am not unable to contact him. So I think this is something has to be addressed on that one. Healthy environment and lifestyle support, I mentioned about it. I think Alex will talk about it. Healthy environment means we need to invest on environment, obviously. So the clean drinking water, sanitation, and of course I think the diet, all these things actually we have to be focusing. Government has always budget for this, but unable to convert into the real picture. And last one is what again our friend Raja said, empowered through. How do they want to be empowered through information. There is information available, how to go, where to go, and things like that. I think we have really work to do through the local municipal committees and other means of it. So I think finally I will say, if each hospital is going to aspire, meet the expectation of the patient, then only I think our country will be able to boast that we are a healthy nation, and we will be able to do what Prime Minister is saying, by 2047 we become developed country. Developed country is only possible when you have the developed health system. I think that is where I end up. Thank you very much.
Thank you, sir. Ladies and gentlemen, next up, it is my absolute privilege in inviting Dr. Alexander Thomas, the founder, president, and patron of AHPI. Sir, please.
Morning to you, and thank you for inviting me. Coimbatore has a very AHPI's heart. It is already mentioned, but AHPI was conceived in conception is conceived in Coimbatore. I still remember Devi, myself, Prem coming for a conference. Raja said there was a hartal in Raja and Rama had organized. We were coming in an ambulance. So we spoke about this, and later in the meeting, there is a effective organization, medical education, but hospitals. That was how HPI was born. Those days, Anbai didn't have any Raja and Rama organized a lot of things. Coimbatore, Raja, Ranga, and the team. So at this time, I also want to, for the team, Tamil Nadu, who started, we naturally reached out. The orthopedic heavy, both Raja and me, orthopedic leadership, both in Anbai and AHPICON, were the first. So happy that how HPI, especially in Tamil Nadu, has evolved. And especially to Coimbatore once again, because without the support of Raja, the team, and we would never have taken off. Raja may not be very actively involved in HPI now, because he is busy carrying the flag, spine and orthopedic, along with spine hand surgery. They're promote our country internationally for HPI in the country. At this time, I also want to acknowledge, along with Ganga Hospital, 3 other hospitals, which are important but good for people. 12 years ago, all of us know. With our hospital, he was a hospital, Baptist hospital. NH also very Ganga Baptist and also the members of the Tamil Nadu Guru from Nakshi, Ram Babu, and of course we have Dad. Raju was also there. I think many of you are there today. We're the founders of Tamil Nadu, and yesterday at the governing general body meeting, very impressed at what the state of Tamil Nadu is doing. And in fact, I was telling Dr. Gyani, Central AHPI should follow what Tamil Nadu is doing. Very organized, very different sections, going ahead very effectively. Looking back, I also, and I'm glad that all the speakers before me spoke about this. I was going to talk to you. When I was the CEO at Baptist Hospital, I used to tell my employees that keep the patient first automatically. In fact, I used to tell my colleagues in Baptist, let us look after the poor and God will look after us. And Baptist has been a shining example of and I think it's important today that when I talk to you, that we keep the patient center, because patient is central to all of us sitting. Patient, we won't be sitting. And as mentioned earlier by Dr. Gyani, that we have to ensure that care is affordable, accessible, of good quality. Very importantly, in this time of technology, that care has to be delivered with passion. These principles are followed, everything else will fall in place. If the patient is satisfied, if they have a good experience and an excellent outcome, then not only do we suggest as individual succeed as individual hospitals, strengthen the very foundation of our country. And I think this is the philosophy of AHPI, and from 4 hospitals initially, very difficult times, to have 15,000 hospitals all over the country. And it is because of this integrity and clarity of purpose, and leaders should remember this. The Government of India and all the major stakeholders recently, after that with the CHS, Government of India, different government states, HPI is now recognized as a mature, credible and stable organization with no hidden agenda. That's very important, and hope that that will continue. And today, when the government wants to engage with the private healthcare sector, HPI is a natural partner. This itself is a great achievement, and it all began. Dr. Gyani said I'll be talking about lifestyle medicine, but there's no time. There's a book that we bought out, and law. It's called Lifestyle as Medicine, available as a free download, available at a very price for me. Please read it. So as when the chief guest was talking about equity, yes, we had I'm an alumnus of law. When I was in Baptist, and still has that, the ratio is 1:50, around that age. And I think it's very important that it's in that range. It's ridiculous colleague is earning crores and you're earning it. Out. So as we look for the future, I have just one message to leaders of AI in Nadu and across the country. Never lose, again I'm reiterating that, never lose sight why we exist. We exist to serve the patient. This single principle will continue to guide us through every challenge, every negotiation, and every reform. As I conclude, I must once again acknowledge the standing leadership of Satish, of Rama, of Sandhya, and the rest of the team, who over the past few years have taken AHPI to a completely new level. Not only have we expanded our reach, our influence, and our credibility, it has been done with beyond what we could achieve when we started this journey. Today, as we celebrate AHPI Tamil Nadu here in Coimbatore, let us also celebrate the spirit of partnership that defines us between hospitals here in Coimbatore, between states, our residents, between sectors, health sector, hearing, all united by a shared vision of ethical, patient-centered, high-quality healthcare. So thank you, Coimbatore, for giving birth to AHPI. I think we all need to give a hand to Coimbatore for starting AHPI. Thank you, Tamil Nadu, for keeping it alive. Thank you, all of you, for being part of that remarkable journey. Thank you.
Thank you, sir. So, ladies and gentlemen, as we move on to the closing remarks, it is my absolute privilege in inviting Dr. Praveen Raj, the organizing secretary. So, ladies and gentlemen, we have Dr. Praveen Raj on the stage here.
Good morning, ladies and gentlemen. That was a wonderful inaugural session to start with, and I'm sure all of you are waiting for the rest of the scientific sessions, which will be starting right away. But before I like to thank the patrons here, I would like to first thank the leadership of AHPI Tamil Nadu for giving Coimbatore this opportunity to host the AHPI 2025. Because as per the principle of AHPI, where they wanted to bring all the healthcare providers together in a collaborative manner, I want to share the pride of being a healthcare provider in Coimbatore, because it's probably one city where every single chairman of the hospital can come together in one single room without the competitive mindset, but with the mindset of collaboration. And it's not for the sake of words. It has happened multiple times, and we have Dr. Raj Sabapathy here, where we once created a social project on gift and organ initiative, where all the hospitals of Coimbatore came together and we successfully did the project. And also, we recently, with regard to the insurance, we had all the hospital chairmen of Coimbatore, not leaving a single one. We came together where we wanted to bring up the idea of how collaboration, we can probably fight the problems, that we can go together. And in that sense, Coimbatore is better than many of the tier 1 cities that we all know of, where many of the corporate hospitals may not be even willing to be part of a joint program where they have their own ways of means in doing it. In that sense, we are very privileged for hosting AHPI 2025 in Coimbatore, for which I would like to thank Dr. Satish Devadas and his team for giving this opportunity, and probably he has made AHPI Tamil Nadu more visible, more popular, and probably brought in more hospitals who have actually eagerly participating, moving forward in this idea of collaboration. I would like to thank our chief guest for the day, Dr. Jairam Varadaraj, for his inspiring words on equity, the importance of equity in his organization, and how we need to take it across in our organizations, and the principles of purpose and also the process. Thank you, Professor Rajsekharan sir, for inspiring a lot of youngsters, and also for making Coimbatore proud, and also for being a pillar of AHPI Tamil Nadu and India. And of course, it was very inspiring to hear Dr. Giridhar Gyani and Dr. Alexander Thomas, who have been the fathers of AHPI in general, and continuing to be a pillar of support for AHPI, and also for your positive words towards AHPI, and also for the support for AHPI Coimbatore. And it was a privilege and a pleasure to be working along with Rama Madam, I think, who was so enthusiastic in doing the entire thing. I would say she carried it all by herself, and I was just watching her with wow, and I could give my little support in making this event happen that is successfully started. I'm sure the rest of the day will also go wonderfully well. Thank you, Adel, Sandhya, Inian, and your team. And I think you just pulled it off single-handedly. Sitting in Chennai and organizing the entire thing in Coimbatore was an amazing effort. I would like to thank all the speakers who have come and who will be coming, who will be entertaining all the delegates. And of course, thank you all the delegates for taking effort to come on a working day to make sure that we need to learn a lot of things and probably coming together, also understanding from each other. And I also like to thank all the sponsors without whom any program cannot be a success. And this has successfully started and will successfully end with all your support. Thank you and enjoy the rest of the day.
Thank you, Dr. Praveen. So, ladies and gentlemen, before we move into the much exciting panel discussions that we have today, I request all the dignitaries on the dais to kindly come together for a photograph over here before they join the audience. So, ladies and gentlemen, we move into a photography session right now, and shortly we'll be beginning the panel discussions that we're all waiting for. Thank you to all the dignitaries on the dais over here. I request all of you to kindly join the audience, ladies and gentlemen. Thank you once again for joining us on the stage. Ladies and gentlemen, today is about a vision, a mission, and for all the possible changes that the future holds for us. So, we are moving into the panel discussions for the day, and the first panel discussion is on the topic quality as a cornerstone for hospital growth. So, ladies and gentlemen, it is my absolute privilege in inviting the moderator for this session. Ladies and gentlemen, once again, it is my pleasure to introduce you to Dr. Arun Palaniswamy, the Executive Director of Kowai Medical Center and Hospital, Coimbatore, one of South India's leading multi-speciality hospitals, a physician by training. Dr. Arun has completed his MBBS and MD in internal medicines, and after practicing in the United States, returned to India to strengthen KMCH's mission of delivering world-class patient-centric healthcare. So it's our honor and privilege in having you over here. So, ladies and gentlemen, a visionary healthcare leader, Dr. Arun Palaniswamy, who continues to guide KMCH towards excellence and global recognition. Please welcome in joining Dr. Arun Palaniswamy onto the stage. Can we have a round of applause for Dr. Arun, ladies and gentlemen? Yes, wonderful. Ladies and gentlemen, next up, I would like to invite Mr. Ashok Kumar J. Ladies and gentlemen, again, it's my absolute pleasure in introducing you to Mr. Ashok Kumar, Executive Director of Salem Gobi Hospitals, one of the most reputed multi-speciality hospitals in Tamil Nadu. A dynamic healthcare leader, Mr. Ashok Kumar has been an instrument in transforming Salem Gobi Hospitals into a model of clinical excellence and operational efficiency. Under his leadership, the hospital has achieved significant milestones in quality improvement, patient safety, and safety engagement, earning recognition at national quality forums. He continues to drive innovation and compassion care as the core values, ensuring that Salem Gobi Hospital remains a trusted name in healthcare delivery. Ladies and gentlemen, let's have a round of applause for Mr. Ashok Kumar J, who will be joining us onto the stage as the moderator. Yes. So right now, I would like to invite our moderator, Dr. Arun, to kindly take over and lead us into the following session, that is quality as a cornerstone for hospital growth. Ladies and gentlemen, now moving into the panel of members that we have for this discussion over here. It is my absolute privilege in inviting Mr. R. Shivanesan. Ladies and gentlemen, let's give him a round of applause. A visionary leader with over 4 decades of excellence in the automotive industry, an alumnus of the Madras Institute of Technology and IIM Lucknow. He has driven major quality transformations at Maruti Suzuki and Ashok Leyland, where his leadership helped secure the prestigious Deming Award for 2 plants. So we're really honored in having you here. Next up, I would like to invite Dr. R. Next up, I would like to invite Dr. R. Parthasarathi. Ladies and gentlemen, once again an honor to invite Dr. R. Parthasarathi, Chief Operating Officer and the Head of Gastric Surgery at GEM Hospital and Research Center, Coimbatore, a well-renowned GI surgical oncologist and the pioneer in laparoscopic and robotic surgery. Dr. Parthasarathi has performed hundreds of live surgeries across India and abroad, authored several reading surgical textbooks and published over 45 international research papers. Sir, we're honored in having you here. Next up, ladies and gentlemen, let's invite Dr. J.S. Bhuvaneshwaran. It is indeed our honor in having an eminent cardiologist, academician, and healthcare administrator, and indeed a motivational speaker, a graduate of Stanley Medical College with MD from Kasturba Medical College and a DM in cardiology from Sri Chitra Tirunal Institute. Sir, it is indeed our honor in having you over here. Now, last but not the least, ladies and gentlemen, let's invite Dr. Anuradha Pachamani onto the stage as a distinguished healthcare leader, clinician, and a quality expert with over 3 decades of experience. She serves as an executive director of Sri Ranga Hospital, Shangalpattu, and a director of Narbavi Multi-Speciality Hospitals in Kanchipuram, a national NABH principal, assessor, and a chairperson of the Quality Professionals Wing at CAHO. Dr. Anuradha is also a visiting professor at AJ Institute of Hospital Management, Mangalore, a global level leader, and holds an esteemed position as an international board member of ISQA and board member of ASQA, and association faculty at the Eden Labs, Harvard, TH. Mama, we're very honored in having you here. So, ladies and gentlemen, handing over the mic to the moderator for the session that follows ahead. Thank you.
Good morning, distinguished panelists. I will hope we have an interesting session ahead of us. We're talking about the topic of the session is that quality is the cornerstone for hospital growth. So one of the things, Mr. Sivanesan, that always fascinated us was the Deming Awards that you've achieved in other industries, and we've become world exporters. So what do you think that hospitals can learn from these other industries that can make us that can lead us forward in our growth pattern?
First of all, good morning all. See, Deming Award is given to companies which are practicing TQM principles. What is TQM principle? It's all about customer centricity. Like every aspect of the management, whether any decision taken, whether it's taken in the boardroom or at the shop floor, whether the customer interest is protected in that decision or not, is the first part, which is the most important element of TQM. Second element is every stakeholder, are they involved in delivering the best to the customer? Whether it is the employees, whether it is suppliers, whether it is all the management staff, how much each one is involved in thinking about continuous improvement. Whatever is being done today, should be better than yesterday, and what we will be repeating tomorrow as a routine activity should be better than today. So, this concept of continuous improvement will only come when every stakeholder is involved. So, as Dr. Jairam explained in the morning, it's a question of heart and head. Not only head, how do we bring heart to the organization? That's a challenge, and that's what TQM squarely addresses. Apart from that, there are a lot of cross-functional engagements and things like that. So, industries have adopted this principle over a period of time. Of course, all healthcare organizations have patient centricity as the main thing. The question is, from satisfying the patients, can we move to delight the patients? Do something beyond their expectation, whatever way it is, by having a discussion which makes them very comfortable, make them understandable, the kind of treatment, whether it is a quality of treatment, cost involved, and the time of delivery. If you look at the QCD, if we can deliver the best, definitely we will be moving from patient satisfaction to patient delight. That is, from moving from patient centricity to patient obsession. I think these are the points which can be taken forward.
So, Dr. Anuradha, as a member of CAHO, you've seen hundreds of hospitals now over multiple years. So what do you think are the metrics, or what do you think is the quality measures which correlate to growth and outcomes that you've seen them repeat year after year? How do some hospitals take it and rise, and how do some hospitals take it as just another certificate that they have to take on board?
Good morning to all of you. And, I'd like to thank AHPI for this opportunity, representing CAHO here. And as you were discussing, CAHO has been handholding various hospitals across India now, be it small or large hospitals. And we see there is a variation in pattern based on the individual leadership. So it starts with the leadership commitment of sustaining the growth. So the leader starts the whole change. So making it as a, just for the sake of getting the accreditation, putting it up on the wall, or they are going to continue the whole thing as a quality journey. So it starts with the leadership commitment, and then we move on to the empowered staff within the organization. So this engagement with the staff is very important. So they have to understand why we are doing this quality standards and why we are implementing it. Only then it will be a sustained growth for the whole of the hospital. So through CAHO, we have tried making everyone understand that it is not only compliance, it is more into commitment. So they have to take on these standards, understand them, and reason out why they are doing it to improve the outcomes as well as improve the patient experience, and then move on. And again, we have various training programs to empower the staff to make them as implementers within their own hospitals rather than taking up various consultation and shelling out so much of money. So that's why we have created basic and advanced courses which are being done online as well as directly into the hospitals now. We have various programs, so you name it, CAHO has it. We train the doctors, nurses, technicians, CSST technicians, theatre technicians, and it has been made more affordable now. Training our own staff has been made affordable because you need empowered staff to understand quality and implement it in their own departments. Again, CAHO has taken it as a more inclusive and creating various collaborative networks so that you learn and share practices from each other. And again, we have tried moving it as a driver for growth of each and every hospital. So it again, when you start implementing quality in your own organization, the trust improves for the patient. So that's how CAHO is creating a quality movement across the country. So with these three or four things: the leadership commitment, and with the empowered staff, and creating your own, understanding your own data within your own hospital. Analyze the data and make your hospitals as learning health systems. So making your own hospital as learning health system, you are able to reduce error, reduce the variations within the organization, and that's how we are able to sustain this quality.
Dr. Bhuvaneshwaran, one of the toughest things I think our previous speaker, Mr. Jairam Vadraj said, to improve great service quality, you have to make the employee stakeholders, you have to enhance salaries. Then yesterday I was at another board meeting with my board of directors. They said, why do you want to spend so much on equipment when you can spend 1/4 of the money? How do you explain quality? First question I got in everyone was ROI. What is the return on investment? How do you explain service quality and quality measures, ROIs, to your board?
Thank you, Dr. Arun. Actually, when we really look at quality, I look at quality on paper and actual quality which happens on the ground level. Because why I say this, primarily people seem to be assessing quality on the basis of certain parameters, probably a checklist based or another measure based, by which we may probably be one of the very good hospitals providing a so-called quality on the terms of paper. I just want to bring it to the notice of the audience what Dr. Giridhar Gyani was telling. He said the top 1 hospital in quality was number 7 in the service provision to the patients. So that means if we really have to have quality, I look at the actual quality service which happens at the hospital, and that is not the responsibility of the quality head, but it's the head of the organization who ensures that the quality what is really being spoken about, the quality which is really being mentioned about is actually it happens in the hospital. Now, you raised a very valid point about the equity, what Dr. Jairam Vadraj was talking about. In fact, as we may be, all of us are aware that the minimum wages, for example, the minimum wages which was proposed appeared very disproportionate, and after thanks to AHPI and IMA, we have got that stabilized at a certain level. And if you look at it, earlier, if I'm correct, the basic salary of a nurse, for example, it used to be varying. I know in some towns it is still very, very poor, very low. It's about 6,000 rupees, 8,000 rupees for some less qualified nursing. And in tier 2 cities, now currently we were paying somewhere around 15,000 to 18,000. Now the minimum wages have made it clear that it should be 22,000. I do see a very good enthusiasm because, again, the point is that if we make the salary part of it being very strong and provided we should sustain it, I'm sure that the output, because a committed worker will always give a better quality service than somebody who is less committed or not committed. But we have to be very clear that I am sure that many of the major organizations, especially the healthcare organizations here, we start seeing the salary part of it is now started crossing 50% of our revenue cycle, which means that we have to heavily spend on the salary. And where again the question of investment into the newer equipment comes, and it really has to be very, very strong balance which has to happen. So, but one thing which is very clear, unless otherwise we maintain an actual quality in the organization, and that quality in healthcare being very, very satisfied and very, very accepted patient, and as Sir said, it's not just patient happiness, it's patient delight. What we call it as a consumer delight, which used to be called in the non-healthcare sector, whereas we look at it as a patient delight. We have to make sure that actual quality exists, not just a quality on paper. The commitment has to come from above, as Madam Anuradha said. We have to ensure a very, very reasonable, good salary, and we have to ensure that a patient delight is the ultimate. Thank you.
Dr. Parthasarathi. Now, I think we heard from all the speakers now that you need to get buy-in. You need equity from all your employees, from bottom to the top. But how do you really motivate these junior level employees, fresh graduates, to understand at 22, 24 years old, to get them to buy into a culture of quality and patient service, which, to be quite frankly, that's not being taught in BCom or in colleges or in engineering. How do you get that buy-in? What do you do to motivate?
Yeah. First, good morning to all, and thanks for the opportunity. That is a great question, Dr. Arun. So we, any institution, even in, if you take GEM Hospital, no, it is more than 25 years or 30 years, many workers from the sweepers to the doctors, no, the continually they are in part of the GEM. But the new, their salary is, the knowledge is more, but their getting amount is little less. But the new persons, no, they have a degree. They have a degree nowadays. And all of you know that in the BSc nursing, what we had 20 years back, very less people. Now, only the diploma in nursing was there. Now the BSc nursing, every people are coming with the BSc nursing. So they expect more salary. But the knowledge, what they are getting during their course, it's little less. So they have to, they are learning from their senior staffs, but their senior staff salary is lesser than that, no, that. So that we have to manage. So always we have to take two things. One is the money management and the man management. So as an organization, they have to take the good people, and we have to keep them in a satisfied level so that they will educate the juniors. Then we will overcome all these problems. So basically, yeah, basically the senior people has to teach the junior, has to all their experience, so that will make the things.
Can I add to the same point? See, employee engagement with the organization. Of course, compensation plays a big part. That's given, that's what being discussed extensively. But the most important for any stakeholder, any employee, whatever level may be, is how much he is empowered, how much he enjoys doing the job. That's what will make them stick to the organization and also do continuous improvement. Whether we treat them as a staff and we give them, these are your roles and responsibilities, stick to that. That's what we expect from you. That is the basic thing. But if you allow him to think for the organization, participate in the growth of the organization, give ideas for improvement, implement few ideas like small kaizens, and also there is appreciation among the people, and there is a continuous engagement with them in terms of communication, where the hospital is planning, what is its vision, how it's being done. If we treat them as partners in the journey and engage them in this thing, I think that will make a very big difference in terms of employee engagement with the organization. One is work for the salary. Second is put heart and head together for the growth of the organization. And if the organization is going to grow, I am sure the individual will also be equally rewarded and he will also grow. That's what all of us in manufacturing industries have experienced. So while we talk about the disparity in salary, this will may take ages to really settle down. I don't know when this is going to happen, because across the world the differences are less, but still we think that 1:38 is a good differentiation. But somebody will say, why that much difference? So most important is one should enjoy doing the job, and we should create such an environment for them to enjoy. That's my view on this.
Mr. Sivanesan, because I think for us, you're the most interesting person because you're coming from outside hospitals. So can you give us a specific example how an organization has transformed? You don't have to name the company per se involved with it. Give any specific examples how they transformed themselves.
See, I come from, my career began with Maruti Suzuki. So at that time when the industry was started, obviously the workman, then supervisor, then shop floor manager, then it goes, hierarchy is there. And the initial engagement with of the employees were for the salary. Whatever you said, I am doing that one. But there they created a culture and an environment. For example, to say that one, if we say that if a workman comes, you first clean your work area before you start the work. So I put a rule like that, until unless I do that one, and I am not empowered to tell him to do like that. So in Maruti Suzuki, you won't believe the plant director himself will take the sweeping broom and clean his area when he starts. All of us used to do exercise together, warm-up exercise across in the same shop floor, wherever you are, you come out of that place, there will be a music for 5 minutes, all the people do exercise. And all the people have food in the same canteen. Even managing director wears the same uniform. So that was the first starting point in India, where we have seen whether it will work or not. People discussed, and many didn't believe that it will bring a good working culture. But today you can see it's one of the giant organization. It has grown stronger than its parent organization. Today, Suzuki Motor Japan's most of profit come from India, and a lot of designs happen in India in the name of Suzuki and goes to the globe. Hope I clarified.
Dr. Anuradha, so we hear a lot about technology, AI, whatever in general you've been seeing. Have you seen anything that really implements at the quality level? Like how do you, like we've talked about AI in radiology, AI in pathology, but how do you use technology to implement care or improve quality in hospitals? What is the thing that has, give us one or two examples which have impressed you the most you've seen the last 1 year?
For that, we need to take the help of technology, specifically in whatever we do now. And when we are going to use technology, we need to see its advantages as well as disadvantages. There are various challenges when we are going to use technology. We have various examples in capacity building or in digital literacy for the patients. So when we started out, I can give you examples from my hospital as well as from KAO. So KAHO has various platforms which we use for training. So we have some, for fire safety, we use simulation training so that they are able to understand it. Even for HIC, we have some simulation training now. So these are some of the ways where we can use, and we can also use artificial intelligence in various ways to make people understand how we are going to do it. Again, you can use these technologies to make people understand about these mock drills, specifically because making them trained and being ready for the preparedness of the hospital to face any emergency is very important. More so because code blues we always see in the hospital, whereas code red, the fire safety is very important. And every hospital has to undertake training of its own employees because it can happen in the night or it can happen in the day, and repeatedly we are seeing in the media. So KAHO has taken the help of various technology means to make help in this training. Again, we have platforms for communication trainings where we have various technology-led initiatives where we can train the nurses, where we do the assessments online. And we have various Kahoot platforms again for this engagement of our own Kahoot people there. Again, for patients, we have various digital literacy platforms coming up. One of it is we use it for the non-communicable diseases now. So we have various programs for NCD because patients have to be engaged repeatedly. So you can use a digital platform for that. Again, we have some digital platforms in India for maternal and child health, where the platform takes you from the start of the pregnancy till the delivery and even in the postnatal time, where the patients can ask questions in their own local language. So these are some of the ways where digital health literacy will help you to have a better patient empowerment so that they are also included in the shared decision making. So only when you empower your patients, patients will start understanding and they will help you to come with a diagnosis and also with decision making also. So we have tried including patients in many of Kaho's activities. We have a forum called the Patient Advisory Council. So we are trying to ask every hospital to include patients in the Patient Advisory Council so that patients' voice is included in whatever we do. So again, there we use some technology to include the patients, where we have started doing the doctor-patient conversations now. And it is a conversation which is recorded and put on YouTube every month. Every last Saturday, it is free download across India, where we take a simple topic so that the patient, it is more into the patient's language. And the doctor gives the answers to whatever the patient asks. So this is a doctor-patient conversation which we are recording and putting it on. So Kaho has taken the help of technology in a huge way, and we have the Kaho Tech conference next week. It is happening in KIMS Kalinga Institute in Bhubaneswar. I would like every one of you to attend it because that's where medicine meets technology. So whatever is the latest which is happening in India or outside India, we are able to showcase. And it's not that technology is very costly. Certain things can be made more simpler, and it has to be more context specific. Then only smaller hospitals can use it. So in many of the Kaho hospitals, we have taken up telemedicine. So even so that we don't depend on various people, because you don't have such specialists in peripheries. In Tier 2 and Tier 3 towns, last 20 years, it has been very difficult. Now with some of the medical colleges coming up, you have consultants there. Whereas you take the help of telemedicine, you are able to give the reports immediately. And these are some of the ways where you can use technology in healthcare.
Arun, actually, I just want to pitch in, adding to what Dr. Anuradha said. See, now you know that most of our hospitals are accredited by organizations like NABH or the JCI. So the parameters are usually KPIs, the key performance indicators. Very interestingly, now there are so many vendors, software companies are available, which make our job very easy, in the sense that earlier what was being captured through an Excel sheet is now being made very possible through the software-based technology. And very interestingly, as an example, we have tried one such software in infection control in our hospital. I would say that earlier the infection control was totally captured manually by a nurse who is running around and trying to capture the data. Now we have made it very possible through a software technology. So that means inside the hospital, for the quality parameters, definitely now we have a lot of newer technologies available as softwares, app-based, with which we have done. In fact, when I was in Abu Dhabi, in one of the hospitals which I was heading, we had made a software which could take total care of the operations, total care of the patient feedback, total care of the infection control, and it was a JCA accredited hospital, so they had all the JCA parameters in the software. So that means I'm sure that I think many of the stalls outside are keeping such softwares available, that quality now can be digitally, can be managed very effectively, and now so much of activities are coming in.
AI practice in gastroenterology points for endoscopy and colonoscopy. Now they have come with AI. So when you're doing a surgeon is doing a diagnostic colonoscopy or endoscopy, so it is a long, it's like a tubular luminal structure. Most of them we are seeing the center side. Even if you see this crowd, we can see the center. So we'll miss the periphery. So the AI pick up all the area. Even surgeons, young surgeons, they miss that periphery lesion, it will pick up. And the false positive rate is very less. That is a great thing. So some of the lesions, early lesion, it's picked up by AI. And another one in surgical part, and all of you know that about the gauze count, and in open surgery or laparoscopic surgery, needles, and sometimes they miss the pad inside. That is a very criminal thing. So we are rely on the staff nurse. So they count the pad or any needles, and sometimes they'll miss it. And so we have a software. It will count what are the thing you are taking it count laparoscopically. So we don't rely on only the staff. So even the software AI will tell, so something is missing. So it is even the instruments, what are the instruments you are using. And we have another AI software. Usually if you do a hepatobiliary pancreatic surgery, the pancreas look like a fat. So most of the surgeons, they remove the fat, they remove the other organs, they injure the pancreas. That will produce the pancreatitis that lead on to most of the morbidity complication of surgery. But this software will clearly tells which is fat, which is a pancreas. The color differentiation. So a lot of interesting things happening in AI that will be useful for a surgeon.
So I think we're slightly running short on time. I think we've talked about patient quality, service quality, how to use the quality to improve employee engagement. Now, for the audience, I'll just give a brief question, one last final question for each of you. What is the biggest challenge or opportunity you see in Indian healthcare in the next 5 years when it comes to quality and growth?
See, the next 5 years will be transformational in every field and also definitely in healthcare. One of the reasons is the development of digital transformation, and AI is going to be one of the major, whoever leverages it and implements it at the earliest will be the winners. That's going to be definitely one of the things. One example which I was delighted to see when I visited an hospital is to get the customer feedback. Generally what we do, we put smiley on the pad and ask them to score, or there is a sheet and you ask 10 questions to do. This hospital get rid of everything else. They told that they go to almost when the patient is coming out, they just give the mic and tell them that whatever you want to say, please tell, positive, negative, what you feel about your experience in any language. And it contain, at least in that region, 3-4 languages it could cover. And while it gets recorded, this gets synthesized automatically and segregated. What are the positive points? What are the negative points? So at the end of the day, supposing 200 patients have come and gone, AI analysis is ready with all the details. These are the things where hospital has done well. These are the complaints and with the intensity of the complaint and also weightage given by the people. It gives the analysis. Then not only the dashboard, but when you want, getting a feedback is for what purpose? To make improvement. So you want to understand deeper, you just click it, completely gives who said what, and then it gives that complete 4-5 statement by different people to understand the problem better. And it happens in fraction of second. I am sure this will be one of the very powerful tools for most of the hospitals.
Yeah, I could see this 5 years back, how it is. So we have NABH now, and Kaho is there to help us, and AHPI. So it is a lot of improvements happen last 5 years in the healthcare. So definitely the future, if you adopt the technologies, quality stops, and your protocols are good, I think the quality will improve, automatically growth will improve.
So I think the challenge, what we are going to see in the coming years will be more on the trust of the patient in the hospitals. Because more and more we are depending on technology, and it's becoming a big thing now in every patient's mind. So the hospitals have huge challenges with the staff shortage and various other challenges which are happening within the organizations, and patients are becoming more informed now. So we need to find out a way where we improve the trust with the patient. So we improve the patient experience, and patients have the trust with the doctors. This is going to be a huge challenge, and how we are going to do it. And for this, again, CAHO has various programs which are being offered, which is called the, we have created what is called the PREM, patient reported experience measures. We call it as a PREM and PROM, patient reported outcome measures as PROM. So these were only available from Western world, and which were not very much onto the local context in Indian scenario. So what CAHO has done is we have created various questionnaires, be it for neurology or orthopedic surgeries. We have more than 20 questionnaires now on PREM and PROM, which is freely downloadable from CAHO site. And these are questionnaires which will help you to understand the patient's experience and improve on it. So these are some of the ways where you can understand how you are going to improve the trust. And only you get the data from your own organization, from your own departments, learn, analyze your own data, see where it is going wrong, and become a learning health system so that you improve on the patient safety. These are some of the ways where you can improve on the challenge.
See, the whole healthcare revolves around doctor-patient relationship. The challenge which we are facing and which we are going to face more and more is the more and more technology is coming in, the more and more quality measures are coming in. It should not happen at the cost of patient-doctor relationship. I'm little concerned that the way, for example, we brought EMR, but now the patients are telling doctors are looking at the computer, not even looking at our side. So a technology has a capability of making things faster, but it can increase the distance between the patient and doctor. This is going to be one of our major challenges in the coming years. The second important challenge is the so-called how do you retain people? The way now things are happening, like in any other industry, like our automation industry or other industries. Now the medical healthcare industry is also going through a spin, wherein the spin-offs seem to be quite a very, very challenging one, because if you need to run a good hospital, good organization, you need to retain good people. Now that's becoming a very big challenge. These are the two important challenges which I feel. The patient centricity, and the patient should never feel that the technology is becoming more important than me. And number two is to retain your resources, especially the healthcare, the human resources which have been your strength to offer a quality healthcare. These two are the ones which I visualize.
Thank all the panel members. I think we can conclude our topic of quality as the cornerstone of healthcare. Very interesting, improving service quality, improving patient quality, employee engagement. And I think finally you says that somehow within all of that, we cannot lose the doctor-patient relationship, the human emotion. So I think he has, our speaker said, customer centricity matched with quality on the back end, the only way to go forward. Thank you all. And for
Thank you for the wonderful session. I request you all to please kindly wait over there because we have had a wonderful session, a lot of insights from the wonderful panel over here. And it is time for the felicitation. I request you, sir, to kindly be here. It's time for the felicitation, and I would like Dr. Raju to kindly come up on the stage so that we can felicitate our panelist members and the moderator. Can we have a round of applause for Dr. and everybody on the stage, ladies and gentlemen? Ladies and gentlemen, we're starting with the moderator himself for the first session on quality as the cornerstone for hospital growth. Next up, I request sir to kindly hand over the felicitation memento to Mr. Sivanesan, please. Ladies and gentlemen, can we have an energetic round of applause, please, from everybody at the back also? Yes, thank you, everybody. Next up, I would like to request sir to kindly hand over the memento to Dr. Anuradha. Following that, to Dr. Parthasarathi over here, and then, last but not the least, we have Dr. Bhuvaneswaran. Ladies and gentlemen, we have Dr. Bhuvaneswaran on the stage over here. Yes, can we have one more photo, one more group photo with Dr. Raju over here? Can we have all of you in the front? Just one more picture and... Yes, thank you everybody on the stage. It was a wonderful session. Thank you, sir. So ladies and gentlemen, before we move into the second session or the panel discussion for the day, we will be having a short break. So I request everybody that you can have a short break and kindly join us back exactly at 12. So you get a 10 minutes tea break over here, ladies and gentlemen. Let's all join back in the venue sharp at 12 to begin the panel discussion on technology as a catalyst for scalability. Thank you.
நல்லா இருக்கு நமக்கு
very happy to share that we have developed a unique and innovative food solution for health and care segment of Sodexo. Arogyam is basically inspired by principles of Ayurveda, the right usage of spices, local sourcing, slow cooking techniques. We are basically blending ancient wisdom with modern recipe. It is to be seen as part of patient recovery, which is given alongside the medicines which patient gets in the hospital. We have also collaborated with All India Institute of Ayurveda, and this program has been developed by our in-house dietitians, culinary team, to ensure that the right nutrition value, right calorific value reaches the patient.
We talk about the retention of the nutrients. Along with that, we talk about the usage of whole cereals and millet. Millets, high in fiber, rich in B complex, magnesium and iron. Very good for all type of lifestyle disorders. It will boost the recovery of the patients.
Our clients will immensely benefit in reducing the turnaround time of patients in hospital. Nutrition doesn't mean that it should come on at a heavy cost. So we have ensured that this is within the budget of the hospitals, within the budget of the individuals, and it is affordable for all.
Today I'm very happy that Sodexo, with whom we have got a great association, has been adopting and also trying to see that we are able to give the right type of food to the right type of patient.
பெரிய கோயில் என்றால் தஞ்சை, நெற்களஞ்சியம் என்றால் தஞ்சை, கட்டிடக்கலை என்றால் தஞ்சை, கலை மற்றும் கைவினை என்றால் தஞ்சை. இத்தனை பெயருக்கு பெருமை சேர்ந்த தஞ்சை அடுத்ததாக மருத்துவத்தில் பெயரெடுக்க அடியெடுத்து வைக்கிறார்கள் ஸ்ரீ காமாட்சி மெடிக்கல் சென்டர். டெல்டா மக்களின் நலன் கருதி தொடங்கப்பட்டிருக்கும் ஸ்ரீ காமாட்சி மெடிக்கல் சென்டரில் 300 படுக்கைகள் வசதி, 100க்கும் மேற்பட்ட மருத்துவர்கள், 25க்கும் மேற்பட்ட புறநோயாளிகளின் அறை, 7 ஆபரேஷன் தியேட்டர்களை உள்ளடக்கிய மருத்துவமனை. தலைநகர் சென்னைக்கு அடுத்து டெல்டாவில் பசுமை நிறைந்த கட்டட வடிவமைப்பில் உருவான மருத்துவமனை ஸ்ரீ காமாட்சி மெடிக்கல் சென்டர். இனி தலை சிறந்த மருத்துவர்களின் ஆலோசனை பெற தலைநகருக்கு செல்ல வேண்டிய அவசியமில்லை. சர்வதேச தரம் வாய்ந்த ஸ்ரீ காமாட்சி மெடிக்கல் சென்டருக்கு வாங்க. தலை சிறந்த மருத்துவர்களின் ஆலோசனை பெருக, ஆரோக்கியமாக வாழ்க.
Medical technology is advancing rapidly, demanding frequent updates and regular maintenance of the medical equipment. High costs and operational downtime affects the progress, quality of patient care, and poses a threat to the reputation of the organization. In India, biomedical budgeting needs to be done carefully so that the patients can continue to afford medical care.
We see hospitals grappling with issues of increased cost of maintenance, lack of standardization, lack of spares, and availability of technical staff.
Getting a biomedical engineer poses many challenges, like depending on non-standardized players, poor response time, huge cost, and accessibility to various regions, all leading to increased downtime. But despite all these challenges in India's healthcare sector, there is a beacon of innovation and efficiency in this complex landscape. The Sodexo Healthcare Technology Management, operating through a mobile app. It is a pioneering solution designed to bridge the gaps within healthcare delivery. With a global footprint and a deep understanding of the healthcare industry's nuances, Sodexo HTM emerges as a critical ally for hospitals and medical colleges across India.
mission is the can buy anything, but main thing is that
there were so many complaints from the even doctors and other people regarding the equipment breakdowns and replacements. So many things were there. Once Sodexo they have come here, they have deployed their supervisors, the technical people here, and there are some equipments those are being rectified within 5 to 6 hours, maximum 2 days.
The CMMS software which is provided, this gives us a bird's eye view as well as a minute-to-minute understanding of the operations which is going on. So we not only know about our inventory at any given point of time, but we also know what is happening in terms of complaints, how quickly they have been attended to, whether they could be attended or not. If they could not be attended, what was the reason, and so on.
Asset tagging after the Sodexo HTM has come in has improved a lot of visibility in our equipment and also has helped us in a lot of critical areas. You keep on procuring new equipment, but the older equipment is neglected. So due to lack of spares or small issues that are pending for a long time, and Sodexo has helped us clear all of them.
Sodexo HTM has made substantial inroads by establishing state-of-the-art office warehouses in rural region, signifying a broader commitment to enhancing healthcare technology management across the nation.
Rajanagaram in Rajahmundry is a rural center. To get a biomedical engineer in different companies, making the appointment, getting the things, making the maintenance, very difficult job. We had a state-of-art simulators, which is very high-end simulator, which cost about 2 to 3 crores. The new company technology is coming on to get the parent company and get the things done. A lot of issues are there.
Streamlining biomedical equipment, one thing off our plate, and help us focus on things that most active approach. Quality of the technology or confidence builds in fact that problem delivering the
all them, and once they came very fast, all the issues we able to deliver our.
We have seen very good level of interest for this service, hospitals and medical colleges, and we are very confident to reach and ensure data-driven preventive maintenance protocols for their medical assets. We are also quite confident that with this service, hospitals would be able to improve and provide a very high level of clinical accuracy in their treatment for the patients. We are clearly able to increase asset life cycle and also reduce hospital capex, thereby resulting in assured and increased uptime delivered in a very cost-effective way.
Sodexo HTM is dedicated to improving the quality of life for all.
very happy to share that we have developed a unique and innovative food solution for health and care segment of Sodexo. Arogyam is basically inspired by principles of Ayurveda, the right usage of spices, local sourcing, slow cooking techniques. We are basically blending ancient wisdom with modern recipe. It is to be seen as part of patient recovery, which is given alongside the medicines which patient gets in the hospital. We have also collaborated with All India Institute of Ayurveda, and this program has been developed by our in-house dietitians, culinary team, to ensure that the right nutrition value, right calorific value reaches the patient.
We talk about the retention of the nutrients. Along with that, we talk about the usage of whole cereals and millet. Millets high in fiber, B complex, magnesium and iron. Very good for all type of lifestyle disorders. It will boost the recovery of the patients.
Our clients will immensely benefit in reducing the turnaround time of patients in hospital. Nutrition.
Hello
doesn't mean
everyone,
that it
I'm
should
really
come
sorry
on
to
at a
interrupt
heavy
your
cost.
discussions,
So we have
but
ensured that
I
this is
request
within the budget
everybody
of
to
the hospitals,
kindly
within the
join
budget
us
of
back
individuals,
into the
and
venue.
it is affordable
I
for
request
all.
all the faculties and delegates and everybody attending today's event to kindly join us back into the venue as we are about to begin the second session of the day. Once again, requesting everybody to kindly join us in the venue as we are about to begin the second session of the day. Ladies and gentlemen, thank you. Once again, it is a humble request to everybody who has joined us here for the AHPICON 2025 to kindly come or join us at the venue as we are about to begin the second session of the day, ladies and gentlemen, on the topic Technology as a Catalyst for Scalability. Once again, I request everybody to kindly join us in the venue as we are about to begin the second session of the day. Thank you.
Going on.
Ladies and gentlemen, once again, it is a humble request to everybody to kindly join us in the venue because we have much more sessions that is scheduled for the day after the second session as well. So for the smooth running of the scheduled program, I request everybody to be in the hall on time. Once again, we'll be waiting for everybody to join us for 2 minutes and we shall be beginning the second session of the day. So once again, I request, it's a humble request from me to kindly join us on the venue as we are about to begin the second session. Thank you. So, ladies and gentlemen, this is a final announcement to everybody who has joined us over here for the AHP Icon 2025 that we are about to begin the second session of the day in 1 minute. So if you have any of your colleagues or friends outside, I request you to kindly ask them to come inside and sit so we can begin the session smoothly and as scheduled. Once again, requesting everybody to join us in the hall as we are about to begin the second session in 1 minute. Thank you. Ladies and gentlemen, once again, welcoming you all back to the AHP Icon 2025 Tamil Nadu chapter, second edition. And we are moving into the second session of the day, ladies and gentlemen, on the topic, technology as a catalyst for scalability. So, ladies and gentlemen, it is my privilege to invite the moderators for this session, starting with Ms. Sandhya Cherian. Ladies and gentlemen, Sandhya Cherian is a Vice President of Frontline Lifeline Hospital and Dr. K. M. Cherian Heart Foundation, a 100-bedded cardiac super specialty hospital in Chennai. She currently looks into the administration of various departments and sets policies for the efficient management of various departments of the hospital. Ma'am did her bachelor's in electronics engineering from Anna University in Chennai. She then pursued her master's in biomedical engineering from University of Texas in the USA, and then going on, she did her master's in public health from University of Virginia, USA. Following that, PG in hospital administration from Loyola College, Chennai, and also did her PG in medical law and ethics from the National Law School, University in Bangalore. Finally, did her executive healthcare management in IIM. She is a recipient of the Super 50 Who Award in 2024, and she is also a recipient of the SME Excellence Award in Health Sector by the Karnataka government. She is a strong advocate for women's education and supports the education of some of the children of single mothers in the fishermen's community of Pondicherry, thereby transforming their lives. We are indeed very happy and privileged to have you here, ma'am. Can we have a round of applause for Ms. Sandhya Cherian, ladies and gentlemen? Yes. Moving on to the second moderator of the second session of the day, ladies and gentlemen, we have Dr. M.K. Enian, sir. Ladies and gentlemen, again, it is my pleasure to introduce you to Dr. M.K. Enian, Managing Director of Sri Kamatachi Medical Center, Thanjavur. Under his leadership, the hospital has emerged as a premier quaternary care institution, integrating a wide spectrum of specialties to serve complex patients with the needs of excellence. Dr. Enian's strategic vision and commitment to quality care placed firmly on the map as a trusted destination for advanced healthcare in Tamil Nadu. Once again, it is my privilege and
good morning, everyone, and welcome to the second session, Technology as a Catalyst in Scalability in Healthcare. It's a privilege to be here among all of you esteemed professionals today. In the last decade, we witnessed technology move from being a supportive tool to becoming a transforming how we diagnose, treat, and even prevent diseases. From AI-assisted imaging and robotic surgery to digital health records and how we scale sustainable